Hello, my name is Zalima Crow. I'm going to be the student nurse practitioner today. I'm going to be doing your HEENT and lung assessment. So we took your vitals earlier. Your blood pressure was 120/80. Temperature was 98, pulse was 76, respiration was 16. Your SpO2 was 100% on room air, and you reported 0 for pain. We have closed all the blinds and doors to ensure your privacy. Do you have any questions, or do you need to use the restroom at this point? Okay, so we did your Snellen chart earlier, and that was reported 20/20 vision. And right now I'm just assessing your overall stature, making sure that you're not in any signs of respiratory distress, such as intercostal breathing, nasal flaring, no cyanosis around the mouth. I'll go ahead and have you just kind of mimic my movement. If you can go ahead and do this with your hand, and then that would be just assessing for clubbing. We'll also do the Fallon test, where you can just hold your hands like this. Typically we would wait a minute to complete the assessment, but we're not going to hold it for a minute. In addition, you can go ahead and lower your arms. In addition, I'm just assessing for your skin for any abnormal moles. Check your capillary refill, which is a 2. I'm going to go ahead and assess your hair. So I don't see any infestation. It's clean, shiny, equal distribution of hair throughout the face. Let's see what else. I'm going to do some cranial nerve testings. So if you can raise your eyebrows, squint your eyes, smile. You can open your eyes, puff your cheeks. Okay, good. That's just cranial nerve 7. Next, I'm going to do a sensory test. So just on your face, does this feel the same as this? Mm-hmm. Does this feel the same as this? Mm-hmm. Does this feel the same as this? Mm-hmm. Good, so that's cranial nerve 5, and that's intact. Go ahead and chew. Good. That's good. So TMJ is intact. I'm going to go ahead and do your lymph nodes. So auricular, post-auricular, occipital, tonsillar, segmental, right here. Let's see. Cervical, posterior cervical. Go ahead and turn your head, and that's deep here. Go ahead and shrug your shoulders. Supraclavicular. Okay. Go ahead and lower your shoulders. Right now, I'm gonna go ahead and let me grab my. Okay, so I'm just kind of noticing your irises here. Just okay, so that contracts. Perfect. Okay, so pupils are equal, round, and reactive to light. So if you can go ahead and look behind me, but focus on my finger. Okay, so pupils accommodate. let's see. I'm just gonna go ahead and continue the eye exam. Sorry. And I'm just gonna look inside your pupil, kind of observe observe your cornea and for any abnormalities. So go ahead and look straight ahead. Okay, yeah, it's gonna be bright, sorry. So I'm able to notice the cornea here, and I don't see any bulging or redness. I'm gonna go ahead and move over to the other side. I'm able to see the optic disc. And no herniation there. Let's see. I'm gonna go ahead and do just for cranial nerve 12. If you can stick your tongue out. All right. That is midline. If you can move it to the left and the right. Good. Go ahead and close your mouth. And if you can press your tongue against your cheek here, against my resistance. Good. And again here. Good. I'm going to go ahead and just observe your mouth. If you can go ahead and open your mouth. Okay, I'm just observing the mucosal membranes, making sure it's moist, no redness, no inflammation, teeth intact. I know, it sounds funny, but it just, gums as well are pink, moist, no inflammation. If you can go ahead and say, ah. Okay, that's also cranial nerve 10. I'm just observing the tonsils of it. Can you stick your tongue out and say ah? Okay, tonsils are about a 2. Okay, yes. That is it. I'll go ahead and do your ears now. Oh, you know what? I'm actually gonna do another cranial nerve test. If you can go ahead and follow my finger. Just kind of doing an H pattern here. And that's cranial nerve 3, 4, and 6, which are intact. I'll go ahead and move on to the ears now. Let me know when you can no longer hear my fingers.
I can hear. Oh, you stopped.
When I stop.
Yep.
Okay. Great. Next, I'm gonna do the Weber and Rhine test. Alright, so for Weber here. Go ahead and be able to hear that?
Yes.
Okay. I'm gonna go ahead and do the Weber. Okay. Does that sound louder or does this one?
That one.
Okay. This one or this one?
That one.
Okay. And then, okay, so right now I'm also noticing whether your nose is midline or not, assessing for, let me just grab my other light here. Oh, that's fine. I'm gonna observe the interior of the nose, observing for any deviated septum, any excess drainage. None is observed. Mucosa is moist. No inflammation. assess just additionally your ears. Any pain or tenderness there?
No.
Okay, good. I'm gonna go ahead and look at the interior of the ear. And I can see the light reflex there. No excess drainage, no redness or inflammation. Move over to the other side. Okay, and same for the left side as well. Let me see it. We did your mouth. Let's see. Oh, one thing I forgot to assess is the uvula. You can go ahead and say ah. Okay, so I'm just assessing and making sure that the uvula goes up and down with ah, and it does. See if there's anything else that we've missed. Okay, so I'm going to go ahead and move on to the thyroid. So if you can just kind of move that way a little bit, just so I can kind of be behind you, perfect. So I'm going to go ahead and try to feel for your thyroid here. Okay. And I'm just gonna push one side. Can you go ahead and swallow? Good. And swallow again. I'm also gonna assess an additional cranial nerve that I forgot earlier. Can you go ahead and swallow normally? Perfect. Okay. I'm gonna here just start assessing for midline trachea as well. Okay. And then if you can go ahead and move your ear or your shoulders up and down. Go ahead and try to shrug your shoulders, but against my resistance. Good. Okay. Now I'm assessing for structure or strength of the neck. So I'm going to push against you, but move against or push against my resistance. Okay. Yeah, I know. Just push against my resistance. Okay. Okay. Let's see. Oh, I'm gonna have you turn your head here. Okay, I'm gonna push slightly. Any pain there?
No.
Okay, turn your head here. Any pain there?
No.
Okay. So next I'm gonna lie you down quickly, and this is gonna elicit any nystagmus or vertigo.
Okay.
Let's see, so I'm gonna just hold your head here, and then I'm gonna have you turn your head this way, and then I'm just gonna lean you back quickly, and I'm just observing your eye movement for nystagmus. Okay, come back up this way. And come back down. And come back up. Okay, so none of the nystagmus was present. Any vertigo present?
No.
Okay. So now I'm gonna go ahead and I'll start this way. I'm
Sorry.
I know, a lot of movement, sorry.
Yeah.
All right, so one thing I forgot to do earlier, I'm gonna have you cover one eye. All right, and with your, I don't wanna like get in the way. With your peripheral, can you tell me what number I'm holding up?
2.
Look straight ahead. So we're assessing just
Okay.
peripheral vision here.
I think it's a 2.
2, okay. And about up here.
I can't see it. Yeah, 2.
Okay.
2.
Okay, go ahead and cover the other eye.
I don't want to see anything now.
Switch eyes.
Oh.
Look straight ahead. Look straight ahead.
Yeah.
Okay, so peripheral vision. Here.
Sorry, one. A one. One. Two.
Oh, good. Okay. Yep. Let's see. Okay, so one thing that I will mention for peds is the cornea reflex test. So for pediatric patients, what we would do is assess for like cornea or corneal reflex, which will shine light in the eye. If not, there's also the cover-up test where we would do a similar test and just kind of cover one eye, have them focus on something or an object, and then cover the other eye. Let's see. Now I'm going to go ahead and have you turn that way. I'm going to go ahead and assess your spine. Okay. Any pain or tenderness?
No.
Okay. Spine is midline. While I'm here, I'm going to go ahead and do your respiratory assessment. Go ahead and hug yourself. Cozy. Okay, so I'm just gonna. Okay, go ahead and say 99.
99.
99.
99.
99.
99.
99.
99.
99. Okay. Tactile firmness is present and equal throughout. Let's see. So right now I'm just gonna do some percussion. Okay, so equal sounds throughout. We want it to sound hollow, and it does throughout. So next I'm going to go ahead and do a measurement of your diaphragm. I'm just going to locate that. All right, go ahead and take a deep breath in and hold it. Okay, and release. Okay, so I'm gonna mark this right here. Go ahead and take another deep breath in and exhale. On the exhale, go ahead and hold. Okay. I'm gonna measure that here. It's about 5 centimeters there. I'm going to do the same on the other side. Breathe normally. Okay, go ahead and take a deep breath in and hold on inhale. Okay. Go ahead and take a deep breath in and then hold on exhale. Alright, that is of 5 centimeters as well. Next I'm going to auscultate lung sounds. Let me actually go ahead and have you move look the other way. Turn around, just look the other way.
Complete opposite.
Okay. So every time I move the stethoscope, go ahead and take a deep breath. Okay. Breathe in, out, in, out. Okay, lung sounds are clear. And then while I'm doing this assessment, I'm also observing for any use of accessory muscles, which are not present, which is good. So now I'm gonna go ahead and do the same here. Any pain or tenderness here?
No.
Okay, so I'm gonna go ahead and do some percussion. Okay. Now go ahead and say 99.
99.
99.
99.
99. Okay. And then I am, again, I'm going to go ahead and, sorry. If you can go ahead and turn around one more time. There's just not a lot of room for me there. Yeah, so go ahead and, okay.
Right here.
Yeah, face me. Actually, this is good, so I can do it here. All right, so go ahead and take a deep breath in. Let me see. Oh, I did forget to mention at the beginning of the video that I went ahead and sanitized my hands prior to the assessment. Let me see. Trying to see if there's anything else that we may have forgotten. And then we did, can you go ahead and, I'm just checking for range of motions of your neck. Go ahead and look up, down, midline, left, right, and then that along with the shoulder movements that we did earlier that assessed for cranial nerve 11. So for the musculoskeletal, we're going to be doing range of motions. So go ahead and just follow my movement. Can you raise your arms all the way up? Flexion, all the way up. Okay, and then back behind you for extension and hyperextension. Go ahead and raise and cross, lower and cross. Okay, go ahead and hold your, yes, like that. That's good. Can you do internal rotation external rotation without moving your elbows.
Sorry.
Extend your arms like this. Don't let me move you. Don't let me move you. Good. Go ahead and hold your arms like this, like bending your elbows. Okay, good. Extend your fingers. Okay, don't let me move you. Don't let me move you. Don't let me move you. Okay. You can relax your hand.
I got rigor.
Okay. Can you radial deviate? Okay, good. And then the opposite. Okay, good. I'm gonna go ahead and try to move your wrists. Relax your hands. Relax your hands. Okay, so against my resistance here. Good. Good. Same with your elbows here. Okay. Good. Go ahead and squeeze my hands. Good. Strength is there. Oh, okay. Not too much. Thank you. Okay, so I'm just gonna elicit any pains. Go ahead and relax. Relax. You can relax this part. Okay, so I'm gonna bring your arm up. Just assessing for shoulders. Yeah, I know this is a not so good shoulder. Okay, and here. Pain there?
No.
Okay, so I'm gonna go ahead and kind of hold on to your wrist here. Okay. Any pain here?
No.
Okay.
It's a good move.
Okay. Any pain here?
No.
Okay, good. We're gonna do the tendon movement. All right, so go ahead and let me know if there's any pain. Pain?
No.
Any tingling down your
No.
hand? Okay. Good.
Sorry.
Let's see, go ahead and we're gonna do this movement for balance test. And then we hold that for a minute. We're not gonna hold it for a minute though. Okay, good. Okay, well, I wish we did it before. Let me see. I'm just gonna have you tilt your head. I'm gonna press down. Any pain with that?
No.
Any pain?
No.
Okay. So I'm gonna have you go ahead and lay down. And we're gonna do the Kernick and Brzezinski sign. So I'm just gonna go ahead and extend your, any pain? Okay. Kernick. Any pain there? Lower back pain?
No.
Okay. Now I'm gonna go ahead and have you raise your head. Any pain?
No.
Okay. So here I'm just gonna have you slightly bend your knee. For McMurray's test, I'm gonna go ahead and kind of apply pressure here. So bowel rest direction and then bowel gust direction here. Okay, and then here I'm just kind of assessing for any possible displacement of the knee or the tibia. We would do the same on the other side. We would assess for both sides. So next I'm gonna go ahead and try to hold your hips steady here as I again, just trying to move the tibia here. Just assess any movement, and there is no movement. Yeah, that's good. Okay. So that's good. Next, I'm gonna go ahead and assess for any fluid buildup. Okay, I'm gonna press medial. No fluid buildup there. No fluid buildup there. Again, just trying to build up any fluid. Okay, none there. Next, I'm gonna do the valgus valrus movement. So, valgus, I'm just kind of internal movement here of the patella. Any pain there?
No.
Same here. Okay. Now for valrus, just kind of external movement of the patella. Pain there?
No. They did none of that on me in the motorcycle accident. It was crazy.
They didn't assess you?
No.
Oh wow.
No, not at all. Not like that.
Sorry about that.
It's a visual assessment.
Okay, and then quickly for the valgus valrus deformities. Valrus deformities, it would seem kind of bow-legged, so we will just kind of assess for that. Valgus is the opposite. It's kind of like internal buckling of the knee, just for those deformities. Next, let's see, I'm gonna do just the straight leg test. This kind of will initiate any radiopathy, kind of pain radiating down your leg. Any pain there?
No.
Okay. And the other side. Any pain there?
No.
Okay. Let's see. Next, I'm going to do a sensory test. And just assessing for any dermatomes here. So this is, when I apply pressure, just go ahead and, lean your head back, just look up. Let me know when you feel my touch.
I feel it.
So this is L4, L5, and then S1. Okay. Okay, good. Go ahead and sit up. Yep. So doing assessment of the upper extremities. Go ahead and hold your hand out. Close your eyes. I'm gonna draw a shape on your hand. Just let me know what it is.
Circle.
Okay.
Triangle.
Good. Okay. Go ahead and open your eyes. Let's see. Next, go ahead and put your arms out like this. Touch your nose with one hand. Now the other hand. Now close your eyes. Now go back and forth with your arms. Yep. Perfect. Done. Next, I'm gonna have you just kind of slap your thigh with your palm and then the back of your hand, and then kind of alternate. Good. Now can you just kind of like touch the tips of your fingers here, kind of back and forth. Good. I'm gonna go ahead and do tendon reflexes now. I'm gonna start with brachio. Go ahead and relax your arm. Okay, radial. Relax your hand. Okay. I'm gonna do the back of the elbow here. Go ahead and push slightly on my hand. Slightly on my hand. Next I'm gonna, this is gonna be tricky. I need your legs to dangle. Can you sit all the way back?
Good luck with that.
Okay.
I ain't Kevin Hart.
Okay.
Okay.
Okay, good. Okay, nice.
They still work.
Wow. Because the dorsal here. Good.
It's delayed. Getting old.
It's a little late, that's okay. Next I'm gonna do the sensory at the back of the, or bottom of the foot here.
Yeah.
It's okay, that's good. And then next I'm gonna go ahead and have you stand up. I don't know if the camera's gonna get out this angle. Stand up. I just need you to kind of walk across the room without all these obstacles. Go.
I like just walk this way.
Okay.
And walk
Yep.
back.
Walk back. Okay, so right here I'm just observing your gait. Good. Okay, now walk back. Can you walk back on your toes? Walk back on
Like
your
backwards?
when you're walking forward.
Oh, like
just
like
walk toes. Okay.
Oh, like my tippy toes?
Yep.
Okay.
Good. Turn around. Walk back on your heels.
Like a penguin.
Okay, good. Now when you walk back to me, I need you to walk with
Like a heel toe?
kind of like heel toe, like right kind of in front of
Oh, okay, I see.
each other. Yeah. Okay. Okay, good. Now let's see. Go ahead and turn around. Now I'm gonna go ahead and assess your spine. Okay, pain, tenderness there.
A little bit.
Okay, go ahead and bend forward. Okay, just assessing for spine to be in line. Good, assessing for any scoliosis. Up. All right. In peds, we also assess for any scoliosis deformities in girls from ages 10 to 12. Boys a little bit older, boys about 12 to 14. Now I'm going to go ahead and keep your hips stable. Go ahead and extend kind of back towards me. No, extend
Like bend?
Extend like.
Oh,
bend.
I see.
Hold on.
Oh.
Hips stable.
Okay.
Now back. Good. For hyperextension, now forward. Flexion. Okay, good. Come back up. Now with your finger by the side of your thigh, go ahead and run your finger down your thigh.
Oh, I see what you mean.
Good. Yeah, just kind of assessing
Yeah.
that movement. Okay, now turn around. We're gonna do the drop arm test. So go ahead and extend your arm out.
Mm-hmm.
Okay, and then I'm gonna hold it up, and then go ahead and slowly lower your arm. Okay, I'm gonna do the same on this side. Go ahead and slowly lower. Okay, good. What else? One thing I forgot to do. Go ahead and have a seat. Extend your hand. I'm gonna place an object in your hand. Just go ahead and tell me what it is.
I'm
Eyes
just covering my
closed. Or
okay.
eyes closed. Remote. Good. And then I would typically give you another object on the other hand.
Okay.
Again, just kind of assessing for sensories. Let's see. What else did we do? I don't remember if we did.
I swear.
Okay. Okay, and like for peds, up until the age of 1, we would do the Barlow and Trelawney specialty test, where we would try to displace their hip. We would flex the knees, abduct the hips, and then try to dislocate it in the from the acetabulum. Trelawney, we would just try to place the hip back into the acetabulum. Let's see. I think one last test that we're gonna do. Go ahead and stand up one more time. Last one. Typically we would do this against the wall, but I'll just kind of brace my hand.
Sure.
And if you can bend your knees and slowly slide down. Let's just kind of test for balance. Good. And up. All right. Good. All right. You can go ahead and have a seat. And I think that completes your assessment.
Okay.